The COVID-19 pandemic hit, countries were left in disarray, finances were overstretched, the healthcare system was overburdened, and acquiring vaccines was a struggle. G20 countries agree with each other that this should never happen again in the future.
The first area is around what we call the 100-day mission. Us are committing to making sure that we have a system in place when there is an outbreak to identify the organism, get the vaccines that are needed, the drugs that are needed, and the other equipment that's needed to respond to that pandemic, and having a global response rather than each country trying to do that individually.
In May, 124 countries voted in favor of the World Health Organization Pandemic Agreement. This agreement formed part of the discussions of the Health Working Group. It binds countries to collaborate should a pandemic potential pathogen be detected.
If a pharmaceutical company is able to access the pathogen from my country and produce something out of it, I'm entitled to 20% of whatever they produce. The 10% goes to the World Health Organization to be distributed among the poorer countries, and the other 10% to the country from which the pathogen, So that's the centerpiece of this agreement that was signed.
G20 countries agree that there's a need for a regional vaccine manufacturing.
This discussion about the regional manufacturing is critical. Actually, this week we held, together with South Africa and WHO, a side event on expanding regional manufacturing and incentivizing equitable access to science and innovation.
While the countries look to prepare for future pandemics, organizations urge them not to lose focus on current ones.
We're starting to really see it from G20 members is a recognition that we have to tackle the pandemics we have today in order to be ready for the pandemics we have tomorrow. And chief among that is a push on inequality. Because what we're finding from research, from studies, is that inequality is making us more vulnerable to pandemics. And that the situation of the AIDS pandemic, but AIDS has been joined by Ebola, AIDS has been joined by Mpox, AIDS has been joined by COVID-19, all pandemics. And at the root of that is the failure to address a set of inequalities.
Pandemic preparedness would also come at a price for countries.
One of which is what we call day zero financing. So if a pandemic started tomorrow, each treasury must have a plan about where the money is going to come from. We also spoke about how national public health institutes need to be appropriately funded.
The Health Working Group has taken a decision to make a declaration committing to their resolutions. It would be presented at the G20 summit in November. Neria Hlakotsa, SABC News, Johannesburg.